Hello everybody, my name is Jorge Villarreal and I'm here to talk to you about LASIK eye surgery. With all the advanced technology we have at our disposal today, it's only natural that the medical field is expanding as well. LASIK, or laser-assisted in situ keratinamyeliosis, is becoming a more viable option for those that would like to correct their vision. Corrective lenses such as eyeglasses and contact lenses are slowly being replaced by the LASIK procedure in order to give people better eyesight. This benefit, along with no required eyeglass maintenance or repairs, and daily cleaning of contact lenses, does not come without risks, however. So, today we'll be going over a general overview of this relatively new procedure, as well as how it is performed. I will then be going over some benefits and risks associated with this surgery. At the end of my presentation, I hope that I will be able to help you, the audience, come up with a better understanding of about how this procedure works. Alright, so with that, let's begin with the general overview of LASIK, starting with a bit of history about the procedure. LASIK is a relatively new procedure that has generated a lot of interest within the public. Now, this procedure was not approved by the FDA until the year 1999. That makes this procedure only 15 years old. Now, according to a survey conducted by Gallup in the year 2000, only 1 year after it was approved, 43% of Americans who rely on corrective lenses would consider getting the LASIK procedure done. 10 years after it was approved, there were already 28 million successful surgeries performed. Today, there would obviously be very many more. Now that we have covered some of the history of LASIK, let's talk about the actual procedure and how it works. LASIK surgery is used to correct vision problems caused by the irregular shaping of the cornea of the eyes. Now, before the procedure is even started, the patient must undergo a pre-examination in order to determine that the patient is a qualified candidate. During the procedure, the doctor will cut a circular incision into the cornea with either a laser or a thin metal blade. This incision creates a flap, which is then opened to reveal the sensitive tissue of the eye. A laser is then used to correct the irregular shaping of the cornea through this flap. The flap is then replaced and allowed to heal. Next, we're going to be talking about the benefits and risks of undergoing this procedure. So, there are several benefits that can be obtained by getting this surgery. The first benefit is pretty obvious. It's improved vision. Afterwards, you're going to see much sharper and much clearer. The second benefit could be that the whole procedure is virtually painless. The most that any patient will feel is just a bit of pressure over both eyes as the doctor is working on them. Next, the procedure is relatively quick, taking only about 30 minutes to complete. This is very enticing to some people, as achieving better eyesight in 30 minutes is not a bad deal. Now comes the bad part. There are a few risks and side effects that the patient should be aware of before they even consider getting the procedure done. Although they are not all serious, they should still be taken into account. Now, there may be some degree of eye discomfort experienced by the patient afterward. This should dissipate and resolve itself within the next few days following the procedure. A type of dry eye syndrome may occur, but this can be easily corrected with a special prescription eye drop, which creates artificial tears that helps lubricate the eyes until healing is complete. Now, severe eye infection and vision loss can occur, but it is extremely rare and does not always happen. So, today I've discussed a brief history of LASIK eye procedure and explained how it's done. I've also talked about a few of the benefits and risks associated with this surgery. I hope I've been given some insight to those of you who may have been curious about this procedure to start with. For those of you who haven't, I hope I've given you some new and interesting information. Thank you, and have a good day.